University Hospital's health systems.
Well, we've got all sorts of reality shows that tout a nip and a tuck and that sort of thing, and all sorts of myths. And if you ever thought about it, you know, you might have all sorts of things going on in your head about, is it okay? When do you get a facelift? We've got all the answers right here. We have Dr. Bahman Guyuron from University Hospitals, probably, you know, one of the best in Cleveland from, you know, for facelifts. Now, my question to you is, when somebody comes to you saying they want a facelift, that's a pretty broad thing, right? Because there are so many intricate things involved.
That is correct.
Yeah. There's also the issue, in fact, usually when people will say, I want a facelift, the friends will say, oh, you look fine, you look fine. How do you determine, you know, when is the right time?
The right time is when the patient looks in the mirror and sees something that he or she is not happy about. From our point of view, from plastic surgery point of view, when the patient is healthy, but there are enough changes in the face related to the gravity effect, aging effect, that by correcting, we're going to produce enough alteration to be worthwhile.
Is there an ideal age?
Not really. Age is just a number. But in general, those of us who do many of these prefer to do the surgery in an earlier age rather than later. And all these actors, actresses that you see, they never change, but they look great, are the ones that they started early. The ones that they don't look good are the ones that they started very late. And there are several advantages of doing this operation earlier. You're healthier, the risks are fewer, the results are not noticeable, they're not discernible to everybody, and also I'm convinced that the results would last longer if we start surgery at an earlier time.
Wow, that's interesting. And you brought some befores and afters with you of people who opted for surgery earlier, right?
Yes.
I think we should, there we go. Wow.
Well, this is not actually very early, but this is a patient who had a combination of forehead lift, facelift, eyelid surgery, and laser resurfacing. And that is what we aim for, a balanced appearance that looks natural, and we can erase about 10, 15 years, and the whole idea is to make the patient the way he or she did about 10 years, 15 years previously.
Almost looks like mother and daughter. So that's pretty dramatic. Now this one, I'm trying
This is the profile of the same patient, just to show, we show the neck, how the skin has been tightened and some fat has been removed from under the neck.
Oh, very nice. Yeah, and I'm sure she's very happy, I would think, right?
Well, the whole idea is to have the patients pleased with the outcome, not to look so different from the way they used to look. The goal of the rejuvenation is just to eliminate the gravity effects, environmental effects on the skin and in the deeper layers when they start coming down and showing in the jaw lines.
And you have one more patient here that we're going to see the before and
yeah, this is a patient, actually she's a physician
and she
who
looks
has
young.
She had genetically programmed condition that allowed the skin to change a lot faster than usual and to relax easier. And you can see on her profile before and after, we have been able again to eliminate some of the flaws, imperfections, rather than making her look different. Again, this is a kind of outcome that we strive for on every patient.
Yeah, that's beautiful. It's so much softer. What is the recovery like for something like that?
Most patients actually can go back to work or be socially active in about 2 weeks, 10 days to 2 weeks. Obviously, it depends on what is the procedure and what type of rejuvenation they undergo, and it varies from person to person, but most patients are presentable socially about 10 days to 2 weeks with makeup.
Oh, okay.
And to get back to absolute normal, it may take about 4 to 6 weeks.
Okay, and there's so many different options out there. It doesn't have to be the old-fashioned thing, but if you want some more information, you can contact University Hospitals of Cleveland, 440-461-7999 or www.uhhs.com, and if maybe ask for Dr. Guyuron, and thank you so much. And I know a lot of your surgeries are also, when there's a birth defect too, and you've done some wonderful work.
Thank you, Eileen.
Thank you, doctor. Good to see you.